Muscle energy technique. Now, as the name suggests, muscle energy. So here we are using muscle's own energy for its treatment. Now, father of MET is Dr. Fred Michel. So he was the person who is known as father of MET because he was the person who discovered this. Now, after his death, his son actually tried to spread this and did a lot of work on this and published a book also on MET. Now, when we talk about MET, what is MET? It is directed and initiated movement, which is patient controlled. So patient does it on its own. Okay. And there is amplitude and time managed by or instructed by the therapist. So whenever you give any isometric contraction in a controlled manner, that is MET. Now, there are different variations in this, but four variations are the most which are widely used. So, we'll be discussing all those in the practical session. Now, there can be failures in MET. It can be because of patient error or it can be because of the practitioner error. Now, whenever we are talking about the errors in case of patient, then what is the error? It can be inability to localize the muscular effort. So, say for example, you tell a patient that he has to shrug it, but he is not only shrugging it, but he is also taking it anteriorly. So it is not focused onto the upper trapezius. So that's why it will not be that effective. Then if excessive force is used in the contraction or the relaxation phase, then it won't be effective. So it has to be in a controlled manner and very less force is being used in MET. That is like only 20 to 30% of the patient's force which he can actually use. So say for example, he can incur 100% force, but he has to use only 20 to 30% of that. Okay, so that's why if excessive contraction is being used, then it won't really be effective. Then if time duration is less or more, it has to be at least 20 to 30 seconds. Hold should be there. Then if contraction is in wrong direction, then also it won't be super effective. Then if the patient is not relaxing, as much the contraction phase is important, same ways the relaxation phase is important. So we have to give both of those. Initiating and terminating the contraction too hastily. So everything has to be very controlled. It shouldn't be very fast or very slow, right? So these are the patient errors. Then what can be the practitioner errors? If the joint or muscle position sense is not there, which is being described by the practitioner, so that is definitely going to create a problem. Then inadequate counter force. So resistance is being maintained to the contraction. So if that is inadequate, then in that case also. If the counter force applied is not in appropriate direction, so that has to be always checked. Moving to a new position too hastily, again, so it has to be a controlled one. Inadequate patient instructions. If the therapist is not giving proper instructions, then in that case also. And also the amount of used force by the therapist, the resistance is inappropriate or too much or too less. So in that case also. So these are the different errors which can lead to failure of the treatment. Thank you.